Your elbow is an incredibly complex joint, enabling you to carry out activities like throwing, lifting, swinging, and hugging. However, this complexity also means that it can be prone to various issues arising from overuse or injury. Formed with the union of three bones, your elbow is an incredible feat of engineering. A sturdy union between your humerus, ulna, and radius of your upper arm and forearm offers both strength in movement as well as flexibility. If any of these parts are damaged, or even if the nerves and blood vessels that surround them become injured, it can cause you immense pain. The Non-Athlete Fitness team has another resource for you if you're looking to find out some common causes of elbow joint pain and ways to find relief. Let's start with some common reasons why your elbow hurts. Number 1. Certain diseases. Although some diseases might cause elbow pain, it is rarely the primary symptom. Here are a few to be aware of. Arthritis. Arthritis can be a crippling ailment, and your elbow is not immune to its effects. The two primary forms of arthritis that may affect the elbow are rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis can be tough to deal with, as it's the leading type of arthritic inflammation affecting the elbow. This condition occurs when your immune system behaves erratically and attacks healthy body tissue, resulting in swelling in joints throughout your body. Osteoarthritis is a degenerative condition that transpires when the protective cartilage covering your elbow bones disintegrates, leaving them to grind against each other and triggering pain and rigidity. Lupus. This illness is caused by your immune system attacking healthy cells within you, from the organs to your joints. It commonly strikes the hands and feet, but can additionally wreak havoc in elbow joint areas as well. Lyme disease. Lyme disease, spread through ticks, can be a serious problem if left undetected and untreated. This illness may lead to damage of your nervous system as well as aches in the joints, particularly your elbow area. Gout. This is a form of arthritis that occurs when uric acid, which is typically expelled from the body, accumulates as crystals in your tissues. When these deposits establish themselves in the elbow joint, it can cause immense pain and discomfort. Number 2. Wear and tear injuries. In addition to sudden, acute injuries, wear and tear on your elbow can occur gradually as a result of repetitive motions. Whether you're playing sports or working in an office, factory, or any other hazardous environment, the possibility of injury is always present. Bursitis. Bursitis can be caused by an injury, a bacterial or viral infection, but most commonly appears due to excessive repetition of the same motion. Your joints are endowed with bursa, which act like cushions to protect your bones, tendons, and muscles. Fortunately, most cases of bursitis are able to be managed through pain medications and will typically improve within a few weeks. Tennis elbow and golfer's elbow. These conditions are all consequences of tendinopathy or tendinosis, a situation where the elbow's surrounding tendon tissue has suffered from overuse. Though the terms originated in golf and tennis, these injuries aren't exclusive to those who play them. We are simply more prone to sustain damage depending on our arm motions when playing either sport. One of the most obvious contrasts between tennis elbow and golfer's elbow is that the former affects your outer arm, while the latter targets your inner arm. Trapped nerves. Are you familiar with carpal tunnel syndrome? It is a condition where the nerve that goes through your wrist gets pressured, resulting in some arm and wrist troubles. You may also experience similar issues in your elbow. Stress fractures. A stress fracture is a tiny crack in one of your arm bones, usually resulting from overworking the affected area. Compartment syndrome is most frequently found in the lower legs and feet. However, athletes partaking in throwing events such as baseball can suffer from this condition around their elbow. Pain associated with compartment syndrome tends to be more intense when an athlete throws. Number 3. One-time injuries. Thankfully, many injuries are one-time occurrences, such as when you take a tumble or get struck hard during an athletic event. Dislocated elbow. If one of the bones comprising your elbow becomes misaligned, then you have a dislocated elbow. This condition can be extremely painful and will require immediate medical attention to reduce any further damage or discomfort. Fractured elbow. A fracture of the upper arm bones occurs when one breaks at the elbow. Typically, these types of injuries occur after a sudden impact, such as contact sports or car accidents. If you have any discomfort and something appears to not be normal, it may mean that one of your bones is broken. Seek medical attention without delay to ensure that the injury is properly addressed. Strains and sprains. When the fibers in your body's muscles are extended too far or rupture, it is known as a strain. A sprain is the result of damaged ligaments. When exerting too much pressure on your elbow muscles, like lifting hefty items or strenuous sports activities, you can strain them. Elbow sprains are a typical injury among players of racket sports, contact sports, and those who engage in throwing. Fix your elbow pain with these solutions. Number 1. Get some rest. Allow your body some time to rest and recuperate by taking a few days or weeks off from activities that cause pain. This could help the inflammation significantly reduce its presence, allowing for normal healing processes. Number 2. Ice your elbow. To reduce inflammation and soreness, ice packs may prove to be a beneficial form of treatment for your elbow. However, it is important to note that direct contact with the skin should be avoided as this can lead to serious harm. To reduce inflammation, wrap some ice in a cloth or towel and apply it to the affected area for 15 to 20 minutes 3 to 4 times daily. For those looking for a simple solution to their pain relief needs, keeping frozen peas in the freezer is an ideal option. These icy vegetables hold coldness well and possess bags that can be shaped as required. Number 3. Stretching. Gently stretching your wrist in both directions facilitates the activation of weakened tendons, permitting for increased mobility and a faster healing process. Retain each stretch for 30 seconds and repeat it 3 times. You may experience some strain, but don't take it to the point of pain. Number 4. Compression therapy. When recovering from an injury like tennis elbow, RICE therapy is commonly suggested. RICE stands for resting, icing the affected area, compressing it with a bandage or wrap, and elevating to reduce swelling. Compression can help reduce muscle fatigue. To experience the effects, wrap a compression bandage around your elbow and gently cinch it until you feel its support. Number 5. Exercise your elbow. Regular exercise can not only aid in your recovery from elbow pain but also help to prevent future flare-ups, depending on what is causing the discomfort. Strengthening your muscles and improving flexibility through exercises can help you relieve pain, reduce inflammation, increase range of motion, and avoid future injuries. Number 6. Over-the-counter pain relievers. Reduce your pain and inflammation quickly with the help of over-the-counter remedies such as ibuprofen and naproxen. To mitigate any unpleasant side effects such as nausea, it is imperative to adhere strictly to the instructions. If your pain persists after a few days of taking over-the-counter medications, consult with your physician about prescription strength relief. Number 7. Use an elbow brace. If you're suffering from tennis elbow, a brace might be the perfect solution to provide your elbow with the necessary protection and support it needs. Before you purchase a brace from any store, it is best to talk with a physical therapist or your doctor first. This will help ensure that the most appropriate support has been chosen and that its use can be fully understood for maximum effectiveness. Another viable option is to consider investing in kinesiology tape. Elbow straps offer a great alternative as they provide compression and support without limiting your movement like braces. These tapes are perfect for providing additional strength to muscles and tendons while still allowing you the freedom of motion. So there you have it. If you're experiencing excruciating pain in your elbow and it looks distorted, seek medical attention immediately. Incorporating exercises and stretches can be beneficial for those suffering from elbow pain, as it may diminish pain and assist with recovery. To avoid any elbow-related disorders, strengthen the muscles in your arm, practice stretching techniques correctly, and take regular breaks when doing anything that involves repetitive motions. Want to learn more? Be sure to check out the other videos on our channel and the resources below to help improve your health and fitness. Until next time.